Now currently at the Alabama Department of Public Health, we had exit interviews, and we got a lot of great information out of those, continue to, but at that point, the exit interview, the employee has already left the department and it's more reactive in nature. So in the stay interview, one thing that really intrigued us, it was very proactive, and it would help us understand why an employee would want to stay with the department, why they might want to leave, and also what the department can do to create opportunities to retain an employee. Our PHIG evaluator and myself, we met and we just kind of developed a timeline. We also took out a TA request through PHIG, and we were assigned a national partner, and we got a lot of great ideas from the Louisiana Health Department, our national partner, a great starting point. We developed our own stay interview toolkit, which included 13 questions we developed. Yeah, the staff that we're looking for is somebody who's in good standing, employees obviously that we want to keep. So we're looking for an employee who has been with the department for 2 years, that has on their last performance appraisal that they were rated to meet standards or above with no discipline, somebody that would be invested in the department. We've conducted our pilot test, and our pilot group consisted of 3 people, and it was our health media and communications group, and we conducted the stay interview with 3 people. And what the process looks like is we send the questionnaires to the staff prior to the interview. That way the staff members have a chance to review the stay interview toolkit questions, so they can put a lot more thought into their responses, and then we actually have our interview team meet with them, and we conduct the interviews, and after that the interview team debriefs, and we group their responses into themes. And then our PHIG evaluator will meet with the supervisor, and they'll review those themes. They'll also talk about expectations moving forward. And then the supervisor meets with the staff member, and they work together and develop a stay plan. With the performance appraisal, and that's what we use with ADPH, you're talking about their work performance, where all employees have their responsibilities and result statements that we're held accountable for throughout the year. Those are basically our job duties. But our stay plans are really where we identify different needs that employee might have outside of their job duties, and we develop a plan and we develop a solution, and we also have performance stays, so we can use those as benchmarks to set for the employees to accomplish whatever the stay plan might be. So the response we've had has just been exceptional. The supervisors, we have multiple programs that really want us to conduct a stay interview with them. We have a stay interview team that conducts all the interviews. We want to make sure that we have consistency in the way the questions are asked. We want to make sure that the employee feels a little bit more at ease when they're responding to somebody that might not be their supervisor, and it also takes the burden off of the supervisor. But we have multiple programs that are wanting us to reach out to them and to conduct the stay interview toolkit with them and their employees. It all goes back down to the community. If we have good employees and we're retaining those employees, then they're doing exactly what our mission statement is. At ADPH is to promote, protect, and improve the health of the people of Alabama. And if we are retaining employees, we don't have those gaps in knowledge where you might experience in turnover, and the employees that we're retaining, or the ones that we want to retain, are the ones that's going to serve our people of Alabama the best.